So, hello, everybody. Welcome back to On the Couch. I'm Stephanie Baker, the Executive Director for Life in Abundance Counseling Ministry. And we are coming back to you with another episode of On the Couch today. I want to take a moment before we begin and jump into things and remind every listener as to what our objectives are here when we do these podcasts. There are three areas that we focus on with various guests. And those areas, the first one would be counseling topics that are relevant right now, things that may seem kind of mysterious and scary to you if you're trying to consider or if you're considering trying to find the right counselor. And when we have those discussions, I'm bringing in not just the team that I have assembled here at Life in Abundance. I am bringing in counselors that are within the Greenville area, the local area, to speak on topics where they have a specialty area or specialized training in those areas. And again, Life in Abundance offers counseling to men, women, and children. We believe that when we strengthen the families, we strengthen our community. The other areas that we want to talk about would be functional nutrition and functional medicine. And in the course of bringing those topics forward, what I will be doing is speaking with functional nutrition and functional medical providers. If you've listened before, you will have already seen some of the podcasts that we've done. And we're going to be talking about functional medicine today, as a matter of fact, with my guest, whom I will introduce here in just a moment. We're also highlighting local ministries that have amazing resources that are in the area, and in the hopes that if you've never heard of them, you through this podcast will become aware of them, and their resources may be something that you might need. Now, small disclaimer before I begin, I am not licensed through the state of South Carolina. In addition to being the executive director of Life in Abundance, I am also what is known as a clinical pastoral counselor. There are members of my team that are state licensed and members of my team that are like I am with my credentialing and as a clinical pastoral counselor. So you're going to be hearing from a wide variety of professionals throughout the course of our podcast episodes. So without further ado, I want to jump in today and introduce our very special guest, Dr. Allison Benedetto. I am super excited that she's here today because she has actually treated me. So full disclaimer, I am a patient and I love the work that she does. If you have seen the episodes with Dr. Ray Benedetto, that's the other part of this power couple in functional medicine. Love the work that they do as a team and individually. So without further ado, she is a doctor of chiropractic from New York Chiropractic College. She has over 21 years of experience, and I can tell you personally, she knows exactly what she's doing. She's also a certified medical practitioner through the Functional Medicine University. She is a professor of anatomy and physiology at Northampton Community College and loves doing that. Dr. Allison, welcome. We are so thrilled to have you here today.
Thank you, Stephanie, for giving me this opportunity to be here with you and your listeners.
Absolutely. So, all right. So the big topic today is hormones. That's what we agreed that we were going to kind of bring to the audience. And, when I work with clients as a functional nutrition counselor, I do a lot of testing. Hormone testing is not one of those areas that I'm comfortable in or trained in. And I know that when I went through a program that you all offer, one of the things that we looked at were hormones, and it made a huge difference for me in the recommendations. I worked directly with you in that area. And so what I was hoping today we might be able to do is take some of the mystery out of what these hormones do, why they're important, and how we test for them, and what you're looking for as a practitioner when you're testing for those. And so let's just start off defining what a hormone is. Let's not assume everybody knows that.
Sure. Yeah, you can look at a hormone. Basically, it's a chemical messenger. It's a molecule that is sent out from certain organs in the body. We call those endocrine organs. And the hormone's job is basically to either stimulate another organ to release hormones, or that hormone will have a direct act somewhere in the body. So some common hormones that you've probably heard of, female driven estrogen, progesterone, but also something like insulin. That's a hormone. So we could talk more about specific hormones, where they come from as we go through. But as we talk about hormones, just think of them as little chemical messengers.
Okay, that's wonderful. I guess an example that, and you push back if I'm off on this, but one of the examples that I use for that would be thyroid stimulating hormone. It
Mhm.
comes from the pituitary, but it's sent out to wake up the thyroid to produce what it needs to produce, which are additional hormones that then go out in the body and do what they need to do. Is that sort of what we're talking about?
Exactly. Yep. That
Okay,
you got that spot on. Yep.
cool. All right. Insulin is a big one that is an interest of special interest to me when we
Hmm.
talk about that. But I kind of want to go back to, you hear when we hit a certain age as women, we start
Hmm.
hearing that our hormones are depleted. We know that throughout our years prior to perimenopause, that hormones rise and fall every single month that go with our
Hmm.
cycle. So what happens to us as we age? What happens to us as women? Sorry guys, this is where I'm headed with this today. But what happens to us as women with those hormones? What's really going on there that causes us some angst?
Yeah, yeah, that's a pretty loaded not a loaded question, but there is a lot that goes on. So just to kind of take us back from the beginning, the ovaries are the organs that produce the primary female sex hormones, estrogen and progesterone. And so once a female starts to have a cycle, there's that natural, like you said, kind of rhythmic production and fluctuations of elevated estrogen during a certain amount of time throughout the cycle. And then that'll dip, and then we have elevated progesterone. And things just kind of go as they should for many, many years until we get to that, and this age, there's no defined age, but it could be for some women, it's late 30s that you start to notice some changes, and that could carry on all the way into your 50s. So it's such a broad time frame, but
Hmm.
basically what happens when we think about the hormones and where are these organs getting their signal from. So again, further up in the brain, pituitary gland, we have some stimulation of those kind of target organs. And so as we progress, that communication pattern can start to kind of go faulty, if you will. But
Okay.
ultimately, the end result is that we are producing less and less hormones to the point where and that will obviously impact your cycle. And so then, say we kind of come through, and you've been diagnosed as being, in menopause, which is going one full year without a cycle. That kind of tells us that those hormones, that estrogen and progesterone, the levels that we're producing now are significantly lower because it's not bringing upon that menstrual cycle. And so then once we get into menopause, we still will produce some estrogen and progesterone. So it's not like it's completely limited, but it's significantly less. But then the adrenal gland can also kick in and start to help with the production of estrogen in that postmenopausal time frame. So
Gotcha.
the big thing too is why it's so personal is some women can fly through that whole process and feel completely fine despite the changes in those hormones. Other women have a significant struggle going through and adapting to those highs and lows that can happen.
Okay. Thank you for that. That's incredibly interesting. Here's a question I have. You
Hmm.
mentioned the adrenal glands,
Hmm.
small little fat cap type things that sit
Hmm.
on top of each kidney, right?
Hmm.
When this is happening, when they're impacting those hormones that we're talking about, is it if we are under what's known as adrenal fatigue or adrenal exhaustion, if we're also suffering from that, does that negatively impact their ability to interact using the other hormones you're talking about?
Yeah, sure. Of course. I mean, I always tell, typically when I meet with someone and we're doing a Dutch test, I want to say the average age of those clients are probably mid to late 50s and beyond. So
Okay.
really, so if anyone is in there listening to this right now, in their 20s, 30s, that's when you really need to prepare your adrenal glands and support and nourish your adrenal glands, because when you come to that postmenopausal time frame, your adrenal gland is going to kind of be the star. And if you're
Mhm.
already behind the eight ball by the time you get to that point, it'll be that much more challenging. But the reality is most of us are overstressed. We're handling way too much. And
Yeah,
so our adrenals are kind of negatively affected. So my PSA is if you're in your 20s and 30s, like now's the time to try to manage stress, good sleep, good nutrition, just overall good habits so that you can set yourself up to be at your best when you start to transition through those changes in estrogen and progesterone.
that's great. So if I'm that person, what would you suggest in my 20s and 30s
Mhm.
that might be helpful for me to actually start advanced support of that process?
Um, I mean, the adrenal glands like things kind of boring and predictable. So, the biggest thing is stress management. I mean,
Okay.
our adrenal glands, one of its jobs, is to produce that cortisol in the response to stress. And it's okay. Cortisol is good. A little bit of cortisol is good for the body, but it's when we get in that chronic stress pattern and then there's an overproduction of cortisol over an extended period of time, that's when that situation is not so great.
Right.
So if we can, at that earlier age, when potentially our lives are a little less complex than what they might be in your 30s, 40s, if we can nail down some really great um, mindset, meditation habits, sleep habits. The adrenal
Yes.
glands love, good sleep. And I think back to my 20s, and I mean, I'd stay up late, like do all the wrong
Right.
things, that now I wish I'm like, oh, I would just love to get, 8 hours of sleep. So,
Yes.
so it's not a glamorous kind of thing, and it's almost common sense. But yeah, good sleep,
Okay.
treating your body the right way with giving good, solid nutrition,
Okay.
physical activity. Um, all of those things can go a huge way to supporting the adrenals. Now, there are adaptogenic herbs that you can supplement with to help support the body, things like ashwagandha or rhodiola or something. I mean, there are a ton of them, and they could be very supportive as well.
Okay.
But you have to also be doing those lifestyle things in
Right.
order for those other things to have an impact.
Right. It's not just a one thing is the magic bullet for
No,
this.
nope.
And I think that we are a community in general that wants a quick fix for things.
Without a
Um,
doubt.
yeah.
Yes.
I mean, myself
Me
included.
too.
I
Me
do that.
too. Right? Who
But
doesn't?
right. You mentioned adaptogenic and
Hmm.
adaptogens. So I don't want to take for granted that our audience knows what that
Sure.
is. We know it comes from plants, but would
Yeah.
you go a little bit further on how that works in our system?
Yeah, sure. So adaptogens are just simply, like you said, most of them are herbal, plant-based. They're
Mhm.
just nutrients and other compounds that help support the body, help support the adrenal glands in times of stress. So some can promote more relaxation. Some can promote, mental clarity without kind of feeling like amped up like you might on
Yep.
caffeine.
Right.
So depending on the adaptogen, it can have a certain effect. Like there are certain adaptogens if you have anxiety and you tend to be a little bit more type A kind of, tightly wound, that there are certain adaptogens that can kind of help kind of calm. So I like to look at them as natural ways to support the adrenal gland and that stress response.
Gotcha. Okay. And so, for those of you that are listening, when we're talking about the stress response system, there are a few podcasts that I've done with Bob Gamble, who is licensed professional counselor, and we've explained the autonomic nervous system, the parasympathetic nervous system response, and the sympathetic nervous system response. And this is a little bit about what Dr. Benedetto is referring to here
Mhm.
in this. So you might want to go back and look at some of those episodes to get a little bit more foundational information on that. So moving forward with the discussion here, what are some of the symptoms if I am deficient? I'm using the word deficient in, or I'm below natural
Mhm.
levels, what I should have or would be normal and standard for me. What are some of the symptoms I'm going to notice? Specifically, let's just start with estrogen. Like,
Yeah.
what am I going to notice?
Yeah. So estrogen and progesterone, before I can answer that question, let me
Yeah,
just address kind of their relationship.
sure.
So throughout throughout a cycling female's time frame and even beyond, we always look at estrogen and progesterone as a balance
Hmm.
to each other because progesterone kind of balances the effects of estrogen. And you can think of estrogen as kind of like the leading role in a play or something. And the progesterone would be the supporting, actors, right? So we do
Got it.
everything to kind of support the estrogen. But if you didn't have those supporting actors, that estrogen, that main role would just be too much, right? So that's kind of how we look at estrogen and progesterone. So estrogen, first, the benefits of estrogen are, it helps with bone mass, and that's very, very important for women. It helps with heart rate, blood pressure
Mhm.
regulation, connective tissue, like ligaments, tendons, flexibility, that kind of thing,
Mhm.
mucous membrane tissue, so keeps your skin,
Yeah.
nice, hydrated. So if we look at
Right.
kind of the flip side there, oftentimes women who have low estrogen, they can have joint pain. Um, um, muscle pain, um, decreased bone mass, number one, but
Yeah.
also some mood shifts in mood because estrogen can kind of help kind of keep us even keel. Also, more kind of I think that we're aware of those hot flashes and night
Yes.
sweats. Those things will come on when we have a drop in estrogen.
Okay. Talk to me really quickly here. Talk to us about estrogen, something called estrogen dominance.
Hmm. Yeah, so estrogen dominance then could either be that you have too much estrogen or you don't have enough progesterone to balance out the effects of estrogen.
Okay.
And
All right.
so estrogen dominance, those types of symptoms, if you're still cycling, can result in, very tender breasts within your cycle, excessive bleeding, heavy bleeding with clots. So when we have too much estrogen, you can think of kind of like inflammation, like that
Mhm.
kind of feeling. But
Gotcha.
but oftentimes, if we support it with progesterone, you can kind of balance out
Gotcha.
those effects because progesterone is calming. So someone who is low in progesterone may have problems with sleep and mood problems because progesterone has a very positive effect on balancing a mood and how we're feeling, and definitely sleep. So a lot of postmenopausal women, one of the issues is poor sleep quality.
Oh, yeah.
And sometimes by supporting that with a little bit of progesterone, they could see a significant improvement, especially in the sleep quality.
Gotcha. I hear from a lot of my clients that are 50, late 40s, even mid late 40s and early 50s. They have hip pain, and
Mhm.
it's not joint pain per se. It's more like the hip flexors,
Okay.
myself included. What are we looking at there? I mean, is that the what you've described as far as one of the symptoms for lower estrogen?
I mean, it could potentially.
Mhm.
I mean, there are a lot of other things that can result in that too. One thing that I didn't say, which I'm surprised I didn't say this, is that um, one common, very common complaint that I get from women who are low on estrogen is that weight gain or the inability to lose weight.
Yes.
And so, I mean, if we're talking about anything musculoskeletal, anytime we put on a few pounds, that can also translate into joint pain because we're just carrying more weight around, and it
Mhm.
tends to be more
Gotcha.
in the abdomen, that kind of like that little pouch that just doesn't go
Mhm.
away, and then maybe around the hips. So that's another thing that we see a lot of. And in
Okay.
fact, most women, that's kind of like one of the biggest thing, that and then mood swings
Gotcha.
are the bigger things that women will notice when they have those lower hormone levels.
Yeah, makes sense. You mentioned, I want to go back to something that you mentioned
Hmm.
earlier, which was a Dutch test.
Hmm.
So let's talk a little bit about what the Dutch panel is. And I had that, you did that with me. It was super interesting, but not a lot of people that I have worked with understand what that is. So would you
Sure.
explain and tell us why you prefer that versus, say, somebody drawing blood,
Hmm.
in that moment?
Yeah. So the Dutch test is using urine. So it's a dried urine
Mhm.
test for assessing hormones. Now, when you have your blood drawn and there's an assessment of hormones, um, that picture, that's going to give us a different picture than what the Dutch test will give us. So the Dutch test is measuring something called metabolites. A metabolite is purely the byproducts of the hormone that shows up in the urine. Because when we have these hormones and things are working in the body, these compounds are broken down, and then the byproducts, we urinate them out. And so the Dutch test is measuring certain volumes of these particular things. Whereas when you do a blood test is measuring circulating amounts of hormone. So, what is really nice about the Dutch test is it can give us a picture of how your body used that particular hormone and how it broke it down as opposed to just what's circulating and available. Just because it's circulating in the body doesn't necessarily mean we're using it. And so that's one of the great things about the Dutch and the company Precision Analytical. And FYI, I'm not affiliated with them at all, but we've been using their test for years
Mhm.
now. I don't know
Mhm.
how long it's been. It's been a long time. I've seen a ton of Dutch tests, and they have the research to show that the dried urine will parallel serum testing. So it's a high quality test. The other great thing is I am afraid to have my blood drawn, as I think some people are too. So it's
Yes.
super easy.
Yeah.
The
Yeah.
collection method is very easy. But so with the Dutch test, it measures, so there are different types of the Dutch test. We tend to use the Dutch Complete, which gives a more complete hormone picture. And you could do this for men as well. I'll just kind of focus on
Yep.
the female panel, but it will assess estrogen and progesterone, testosterone, because women also need testosterone.
Mhm.
And then it also, we like to do the adrenal portion of it as well, where it will assess cortisol, both circulating cortisol and metabolized cortisol.
Mhm.
Again, giving us that kind of picture. While you might have a lot of cortisol, is your body actually using that? And then if so, okay, what is it doing with it? But it also looks at DHEA, which is another adrenal hormone. So really, really great, comprehensive, simple way to get a snapshot of all of these different hormone levels.
Okay. And when you get those back for your clients, so let's
Mhm.
say that I'm somebody listening to this and I'm thinking, okay, I really want to talk to her and do this. When you
Mhm.
get that back, that panel back, what are you specifically looking for?
Well, a big, big part of this is based on the client and what struggles or challenges they're having. Because you can have something show up and it might be low estrogen progesterone,
Hmm.
but the person's like, no, I feel fine. I feel great. I have no problem. So in that case, I wouldn't just unnecessarily say, we're going to do X, Y, and Z. Do
Right.
you know what I mean? You would do some
Yes.
supportive things that are kind of
Right.
general across the board. So I take into consideration pretty heavily what the person is telling me are the biggest issues for them. And so then I like to use the Dutch test to see, okay, is what you're complaining of and what you're going through, can I find a connection on the Dutch test? Because oftentimes, fatigue, brain fog, sleep, inability to lose weight. There are quite a few things that can contribute to all of those things. But
Right.
a lot of times, women especially get the, oh, it's just your hormones. And so
Yep.
doing the Dutch test, we can look and say, well, no, actually, your hormones look pretty good. So maybe it's this. And then
Something
you can
else.
explore another option. Yeah.
Okay. So if you get this back and somebody they're tanked,
Hmm.
what then?
Right. Yeah. So when it comes to the different hormones, um, when there's low estrogen and
Mhm.
someone wants to take estrogen hormone replacement therapy, with
Mhm.
estrogen, there's a lot you have to think about before you opt for estrogen replacement therapy, which it works really, really well for a lot of women. But if someone is interested in that, I kind of defer them to their, endocrinologist or gynecologist to
Mhm.
work on the estrogen because estrogen is one of those hormones, if you're not metabolizing and breaking it down properly, and that's one of the other great things about the Dutch test
Mhm.
is it shows us specifically with your estrogen how your body is breaking that down because without getting into too much detail, there are
Right.
different pathways. There are different byproducts of estrogen that are very safe and beneficial. There are some that if you have too much, it can kind of take you down the path of kind of a precancerous thing.
Yes.
So when we get to estrogen and somebody wants to take exogenous estrogen, I'm like, okay, I'm not going to help you with that, but I can
Mhm.
help you with all this other stuff.
Right.
So looking at the low levels, progesterone, oral progesterone is something that a lot of women can do that can have a really nice impact. The adrenals, I focus on that and recommend. Some of those adaptogens we talked about
Mhm.
earlier or lifestyle things. Sometimes we see the Dutch, and on some occasions, I'll say, okay, this came up. Let's do a blood test because I want
Mhm.
to look a little bit deeper. So it's a really great way to add in a line of support, but
Mhm.
also gives us more information if there's something else then that we need to pursue.
Right.
Hmm.
Okay, so let me step back for just a second. We talked about the Dutch test being or using urine because
Hmm.
you're able to track metabolize the byproducts in the
Yes.
urine. Okay.
Yeah.
And the reason that blood serum might not be the first thing that you would go to, it's about what's circulating, but
Hmm.
blood tests, which I try to explain to clients, it's a snapshot in time at that
Hmm.
very moment.
Right.
So, as best I recall, when I did the Dutch test with you, it was samples over a course of a
Yes.
24-hour span, which I love
Correct. Hmm.
because you got to see the natural,
Hmm.
24-hour rise and fall or whatever. Um,
Yes.
yeah, I think
Ex-
that's huge for people to understand. Like, why would you choose that
Yes.
over just the
Yeah,
blood?
exactly. Right. The blood test is only, with the exception of hemoglobin A1C, which
Right,
gives you more, a longer term time frame, you're just drawing that blood and whatever is available at that moment.
is what you're seeing.
So the Dutch Complete, yeah, when we're looking at the hormones, and two, I should say that if you are still cycling, there's
Mhm.
a very specific window of time in which you do the Dutch test because we know basically what the estrogen and progesterone should be doing,
Right,
around that 19 to 21 day part of a 28-day cycle. And so
gotcha.
we time it with that window of time to see how that matches up to what it should typically be. Um, so yeah, the other thing for a cycling female, if there's someone who has a very irregular cycle, but
Mhm.
they are not in menopause, there's actually another form of the Dutch test that you do a sample every single day. It's called a Dutch mapping. And
Okay.
you could do a sample every day until you do get your cycle, and it will plot your estrogen and progesterone for an entire length of time so you could really
Wow.
get a good picture as to what's
Wow.
going on.
So when somebody does that with you, or you order it for somebody
Hmm.
and they send it back to you, or send it to the lab rather, what's the average amount of time it takes before you get the results back?
It's they've gotten a lot faster, I want to say. So it's depending on when it's received by the lab, probably like a week to week and a half of like business day kind of thing. So it's a fairly quick turnaround when
Yeah,
it
that is
comes
a quick turnaround.
to some of these tests. Yeah.
Okay. So if I'm out there and I'm listening to this and I'm thinking, my doctor has never said, my primary care physician, my gynecologist, I've never heard of this.
Mm-hmm.
Why aren't they telling me about this test? Care
You
to
know,
speak
that's
into that?
It's a really great question. And honestly, I don't know why more physicians don't know about it. There are some times that we get clients coming to us who
Hmm.
it was ordered by their gynecologist or whomever, but yet then they don't know how to interpret it. So they've at least heard of it and ordered it, but then don't know what
Right.
to do with the information. I think because for some practitioners, they might just still be in that kind of that box of, this is where we are and haven't quite explored outside of that. And I've also had, unfortunately, experiences where, someone will take the test to their whomever and say, hey, my functional medicine doc did this. And they're like, oh, yeah, that doesn't tell us anything.
Right.
So, so I don't know why. I wish it were more, but I do think that more and more practitioners are slowly starting to kind of see that there are other things out there.
Yeah, I'm really glad that there is. I mean, I know for a fact there's a movement of that. There's a
Hmm.
movement within a client base that's like, we want more.
Oh
There's
gosh,
more and
yes.
we want more. And I am seeing that. But
Yes.
I've actually had, and I've told Dr. Ray that I've had doctors, primary care physicians get upset that I've actually asked clients to go and get certain blood tests,
Mm.
and it's come back and they've had things like Epstein-Barr or reactivation or Hashimoto's. So
Hmm.
I think the mainstream medicine community is going to have to at some point start widening the scope of what they're using
Definitely.
for tools.
Hmm.
You know, this is great. I have what might seem like a really unrelated question, but so cholesterol,
Hmm.
how does that impact, or does it? My understanding is the foundation of the hormones that we've even been talking about. What do you see in relation to cholesterol levels typically when you see people whose numbers are tanked? Is there any
Hmm.
kind of correlation that you witness?
Yeah, so the backbone for the chemical structure of a lot of these hormones, estrogen, progesterone that we're talking about, is the cholesterol
Mhm.
molecule. So we do need some level of that dietary fat, that cholesterol, in order to make hormones.
Mhm.
So I see it a little bit more on the later end that if there's less hormone production. It there's a parallel to lower cholesterol levels. However, I have seen it also in younger women who may be very restrictive in their diet and not eating much fat at all.
Mhm.
And
Yeah,
so and then they don't typically feel well, right? And so when you check, like the cholesterol levels are really low and their hormone levels are also low at a time when they should really be a lot higher.
right.
So is that the definitive? It's probably not the only thing, but I do see a parallel between cholesterol levels and these hormone levels.
Okay. And you just made me think of something else too when you were
Mhm.
talking about the younger women in this. let's say that I'm struggling with an eating disorder.
Hmm.
Um, Talk to us as briefly as you can. I know this is a loaded topic, but
Hmm.
how that may impact my body,
Yeah. Well, I mean, if we purely look at food as our fuel,
right?
right? Because as soon as we eat that food, our body's job and all it knows is to break that down and extract the nutrients from it that we need to survive. And there's a basic level of nutrients that we need for our body to carry on its normal things. That's called our basal metabolic rate. And
Okay.
so if we're not getting adequate nutrition, I mean, how does it impact our body? Everywhere.
Right.
Because then we're just not going to get those nutrients that we need to do our normal daily things. And so then, you can see fatigue, you'll see like muscle wasting, hair loss, all of
Mhm.
those things because we're just not getting the nutrients that we need to survive and function. So yes, it is a very kind of heavy
Right.
topic.
Right.
But yeah, foundationally, it's where it has to start, like with getting those nutrients, and it's all of them. Like fat is good, right? I think
Right.
we've been. I mean, I know I grew up. My mom was always like low fat, no
Right.
fat, you know.
Right.
So it's hard sometimes
Right.
to eat and do these things, but when you make the right choices,
Mhm.
it's really what your body needs.
Yeah, that's great. So, last question, because I know want
Hmm.
to be respectful of time. Um, if you're working with somebody and you're helping them supplement, I realize every patient for you is going to be unique,
Hmm.
but is there an average amount of time before they start to feel better working with
Um,
the hormones?
Yeah, right. So I think number one, it depends on where we're starting from.
Hmm.
If it's relatively recent, kind of we're transitioning to that. Someone like that might respond a little bit faster to someone who's been dealing with for, 10, 15, 20 years. Um, but ultimately, I always like to say, well, bigger picture, anytime you do any kind of natural supplementation, you have to give it like 3 months. You have to give it three
Yeah,
months.
yeah,
However, most people will respond, even if it's a little bit, they'll respond within the first, I want to say, 3 to 4 weeks, like noticing shifts in energy, mood, that kind of thing.
yeah.
But it's like one of the first things that I discuss with a client is like, this is like, when coming back to what you said about instant gratification, this is not an instant gratification thing. If you take this and you immediately feel better, like a pharmaceutical,
Right.
it would be a different story, but it's not. So it's all about the long game. And I like to say it's creating these habits that become your lifestyle. And
Yes,
so when it's your lifestyle, you don't even think twice about it.
that's
And
right.
and then that's with you for the long term.
Yes.
So yeah, but with all that being said, usually within those first couple of weeks, and
Hmm.
if things aren't kind of after about like a month, month and a half, if nothing has changed, then I kind of reassess and say, okay, maybe we need to shift gears a little bit and then try something else, that kind of thing.
Right. I've seen in just working with some of my functional nutrition clients when they've been going through major stressful events, just
Mm.
supporting the adrenals. It's a
Oh yeah.
fairly quick turnaround in
Yeah.
what they report that they feel.
Hmm.
But I love that you're saying it's the long game,
It
and
is.
we know that also this has been so helpful in explaining things to those that are listening, because we know that when someone understands what's going on,
Hmm.
it's different than just saying, well, don't eat gluten.
Right.
It's understanding what's physiologically going on in your body without having to go back to school to study the science, like
Right.
putting it in an easier way to understand that if this is missing, this is what the result is going to be or
Mm-hmm.
possibly be. And when people understand the why behind decisions, sustainable change is a lot more probable for them.
Yeah.
And I see better results when people understand the physiology at a certain level,
Sure.
for
Yeah,
them. So,
definitely. And we've really only scratched the
yes,
teeny
yes,
tiny
I
layer.
know.
But yes, it does. It does. And I always say you have to ask questions. You have to know why,
Yes,
because otherwise you're not motivated to do these things because you don't know why you're doing what you're doing.
right. And I think to, again, not to bash mainstream medicine. I mean, I'm very glad that we have acute
Hmm.
care, but it's hard, I think, for clients or patients to feel like they can ask deeper questions about
Hmm.
things,
Sure.
because typically they've got, a 10-minute window with the
Right.
provider and then they're out, they're out of
Hmm.
the room. And so I just want to encourage anybody listening, you need to be your own advocate. You need
Hmm.
to ask whatever your questions are, and don't be satisfied until you have an answer that you understand.
Hmm.
I think
Yeah.
that's hugely important. So,
Yeah.
Dr. Allison, I have loved spending time with you today. Thank you so much for your
You're
patience with my
welcome.
bazillion
Yeah.
questions.
Hey,
We would
I love
love,
questions.
yeah, we would love to have you come back,
Sure.
and dive a little bit deeper into this. As you said, I mean, this is a sea that we could
Hmm.
go swimming in right now,
Yes. Oh,
right?
for sure.
And
Definitely.
so we'll have you back if you're able to do that, and we'll
Yeah.
dive into more. But thank you so much for what you do for your patients. And if somebody wants to get in touch with you, what's the best way for them to do that?
Well, I can leave you with an email address
That's great.
or if however in the past you have kind of directed anyone to my husband,
Hmm.
we're a team, so
Yep.
we work together, so that way is fine too.
Okay, that's great. Is there an email you want to
Yeah,
leave? Okay.
sure. It would be my first letter of my name, Benedetto, Benedetto, D is in dog, C is in cat, at gmail.com.
All right. Perfect. That's
Yeah,
great. Thank you again so much for your time. I really appreciate it. And we'll look forward to
yes.
hearing from you
Thank you.
again. Uh-huh.
Definitely. Thank you.
Yeah.